Welcome to Legal 123s with ByrdAdatto. Legal issues simplified through real client stories and real-world experiences. Creating simplicity in 3, 2, 1.
Welcome back to Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, with my co-host, Michael Byrd.
As business attorneys for healthcare practices, we meet a lot of interesting people and learn their amazing stories. This season's theme is the future of wellness, where longevity, advanced weight loss solutions, and anti-aging innovations collide. Get ready for insights from the people driving the evolution of the medical industry.
Now, Michael, I'm excited to bring on the guest for the show. Today, we'll be talking about the intersection of orthopedic surgery and the wellness service. I know that sounds weird, but yes, they're coming together. And, Michael, this is a legal show, Michael, and as you know, and I thought we should address legal updates that happen every once in a while. I'm not sure if you heard the really, really big legal news coming out of the Fifth Circuit of Louisiana. I want to be very clear before we start. This is not a legal advice. This is legal nostalgia.
Well, Brad, anytime you start with legal nostalgia or any time of nostalgia, I get nervous. That usually means one of two things. Either you're going to go into 1980s movie talk or some sort of college story.
Well, you'd be correct in both. But in this case, the Fifth Circuit just ruled that the federal ban on home distillery of moonshine is unconstitutional, which means, legally speaking, my freshman year at TCU just got retroactively vindicated.
I'm quite sure, Brad, that the court did not do anything relating to your activities at TCU.
Okay.
But I do want to learn more.
All right. Now, Michael, if you promise not to tell anyone, I have a confession to make.
Well, it's just the two of us and Kennedy and our guest here. You're among friends. It's a safe place.
Okay, safe.
So please bear all.
All right. Freshman year in college, Easter weekend, Longview, Texas, was the first time I ever drank moonshine. It was served to me in a mayo jar. It was not very aesthetic looking. Luckily, there was no mayo residue added, of course. But I have no regret.
I mean, if this were the red flag season, my first ding would be, you said the first time you ever drank moonshine. So
you got that, huh?
Yeah. And it explains a lot about you, and it explains for the audience, the potential long-term effects of drinking moonshine, even one time. Just look at my partner over here. But excluding the fact that you drank out of a mayo jar, how was it?
Well, I'm not a connoisseur of moonshine, but let's just say it was not the best tasting drink I ever had. But it shouldn't have been criminal, I guess, is the way I'm kind of thinking about it, Michael.
Okay. Are we still in that safe place
Yes.
I mentioned?
Yeah,
okay.
I think so, yeah.
Well, I have to confess too, Brad, I've also tried moonshine one time for me many years ago. Now, I can't use the college excuse. I was actually a young adult with young kids when I decided to do it.
Oh, no.
And mine was even more stereotypical. It was at a ranch in rural Oklahoma. And I agree with you on the taste. And I am grateful that it did not blind me.
Yeah, me too. Well, I guess the legal takeaway we can give for our audience is that 150-year-old law struck down still doesn't mean you can distill moonshine in your backyard. I'm sure there are permits and state laws and other regulations and things you got to worry about.
Yeah, we're definitely not moonshine attorneys. So yeah, but that does raise some questions on federal overreach, regulation, and where constitutional limits actually are.
Yeah, I agree. But Michael, it also raises the last question: should anything ever be served out of a mayo jar?
That's really the lead question that we should be talking about today. And audience has heard my opinion on mayonnaise. I believe there needs to be an amendment to the Constitution banning this type of behavior.
Why do you got to be such a hater of mayo, Michael? All right, audience members, to be clear, we're not encouraging drinking or distilling of moonshine.
Or mayo.
Even if the law allows both. But let's bring on today's guest before he regrets joining us.
Okay. Joining us today is our client of ours, Matti Palo. And he is a physicist and a board-certified orthopedic surgeon. He has a practice in the New Orleans area. He's been in practice over 24 years, has 5,000 operations, and he has a unique background, education, and worldview that is really geared towards changing the way healthcare is delivered, and really interested in this conversation.
Yep.
He's also a serial entrepreneur, so a doctor after our own hearts. He founded Palo Medical in 2012 with the express purpose of improving solutions in the areas of post-orthopedic surgery recovery and to aid in the treatment of common orthopedic issues. He's also founded a healthcare platform that facilitates direct connections between patients and practicing clinicians, and a co-founder of another startup or entity that is a deployed solution that manages the entire surgical process for all stakeholders, from scheduling through capturing charges involved in surgery. He's a first-time guest. Welcome.
Hey, thanks, guys. I appreciate it. And I'm glad you brought up the blindness about moonshine, because that's the one thing I remember about moonshine that I learned in medical school. So that's pretty pertinent. Yeah, I appreciate the intro.
Well,
thanks for having me.
Since you learned that in med school, which I guess I did not learn that because I did not go to med school, does that mean that because you're in the greater New Orleans area right now, you've never had the opportunity to drink moonshine or distill it yourself?
I definitely have not distilled it myself.
Okay.
I was actually, true story. I went to the Bourbon Trail to go check it out. And I got so fired up after going to one of the distilleries, I started looking up, how do you distill this at home? Not even, I don't know anything in the history of moonshine or anything. And, you can imagine I got like about, 10 minutes into my search, and I realized that it's illegal. And I guess that's where all the moonshine talk came from, because I was so fired up. They gave me such an in-depth explanation at one of the distilleries. I'm like, I'm definitely doing this. I'm a science guy. I am so in. And I was disappointed. So maybe that rule will change with the new information, the bomb you dropped today.
Yes. Exactly.
It kind of lines up with healthcare. Like every time you want to do something, you find out there's some law that affects what you can do.
Oh my gosh, that is so true. So true.
Well, I'd love to kind of start with some introduction and talk a little bit about your path as a physicist and a board certified orthopedic surgeon. If you want to talk a little more about any of your startups that we talked about in the intro, I'd just love for the audience to learn a little bit about you.
Yeah, I think it's kind of a meandering course. My undergraduate degree is in physics. I was always drawn to systems, problem solving, kind of getting to the root cause of how everything happens. It's so funny. Like I'm sure there's other doctors who have undergraduate degrees in physics, but I haven't met them. And I kind of made the switch. I was in my third year, and I was I was at a physics party, and I was at the party, and it was like an episode of Big Bang Theory. I was kind of walking around, and I was working the crowd. I'm talking to all the guys, and we're all at tables of two, and it was all guys. And I kind of flashed forward to the future. I was like, gosh, I don't know that this could be the rest of my life. And then the next semester I took an honors zoology course, and two things struck me. First, I was really drawn to the biological systems, right? It kind of get into the root cause of biology. And the second thing was there were girls in my class. So those two things were highly instrumental in my transition from physics to biological science and ultimately medical school. But it's pretty interesting. And the background affects how I look at wellness and all those pieces too, kind of getting to the root cause of everything.
Well, that's smart. I think you made some good decisions there.
And talk about your practice. Tell us about your practice now.
Yeah, sure. Yeah, so I am in private practice. I have run the gambit. I've been employed. I've been in a group practice, and I've been in private practice. I'm a solo practitioner. I do predominantly surgery of shoulders and knees, but I kind of do everything. So, like you mentioned, I kind of have been a bit of an entrepreneur. I have a few other, besides the software and my medical practice. I was a co-founder in a hospital around here, which has been great. Physician owned, which is really, to me, instrumental in kind of how healthcare should be delivered. just sort of a lot of different things that have kind of come together with the way I practice. Even the way my clinic is set up is a little bit different, where I have patients that kind of enter directly into the rooms, and then I have kind of a racetrack around the building, and it just kind of keeps me efficient on time, operationally, well grounded, and I just think it's a great way for me to practice.
Well, that brings us really into our first, I guess, question from the audience perspective here is that, as you heard in the beginning, this season we really are focusing on the future of wellness. And when we say wellness, we're including longevity and weight loss and anti-aging. But what's your why for moving into the wellness, and what is the problems that you're trying to solve from a traditional orthopedics, which is, again, it doesn't really fall into that normal category with orthopedics?
Yeah, so I think the why is just kind of this big gap between the way traditional medicine practices and what patients are actually looking for. So one of the things I'll never forget, one of my first businesses in Palo Medical, you mentioned that in my introduction, was I had the IP around a cane that helps you stand up from a seated position. Long story short, I did everything for this. I was a surgeon, right? I know how to do everything. So we could have a whole podcast on that stupidity in my past. But I manufactured in China. I went on QVC. I got it registered and cleared to the FDA as a one-man show, right? Wow. I was on fire, and this is all while I was doing my orthopedic practice. But one of the things that I really got humbled by was sales and customer service. And because I did all the customer service myself, I would do outreach, and I would talk to a lot of times it'd be these senior citizens, and they'd be, I had so many funny stories, but these guys who would get me on the phone, they talked to me for an hour about this cane and how it changed their life and all of these pieces. And it really, gave me a sense of kind of the problems that people have, what they're looking for. And I really do think that there's a gap between what we provide as clinicians, as doctors, and what people are looking for. People are looking for that Starbucks experience. You walk in and you go up to the counter and you order your coffee. They call you by your first name. They look in the eye. They teach you the Starbucks vernacular. It took me I was a slow learner. Probably took me 5 or 6 years to kind of learn the venti and grande and all that. I still get it backwards sometimes, but just the way they have consumerized it. And that's what people, I think, are looking for in healthcare as well. And then from an orthopedic standpoint, I think, there's a big fragmentation issue, right? Meaning that we have, I'm a surgeon. You come to see me for surgery, right? Oftentimes you're not optimized, right? We have all these rules, right? Insurance, in order for us to pay for it, sometimes they're saying, hey, this patient needs to have a body mass index under 40 before you can even operate on them. Well, these people have tried everything, and now they can't exercise, and they can't get the weight off. And that's just one side of it, and right. Then the other thing too is affordability. You try to keep the cost down for these guys. So the patients have the same problems. It's access, it's cost, it's they have these things that they're trying to solve, and we are kind of in the position to kind of help them along the process. I do different things in my practice, and it's sort of like not just the wellness side, but it's also the financial side, and kind of talking to them. And look, this is something that's completely changed in my career, because probably 15, 20 years ago, if a patient came in, I never talked money ever about what a service is going to cost. And I just assumed when I ordered physical therapy for somebody that they were going and they were getting their physical therapy. They're going 2 to 3 times a week. And then when they would come back to see me and they would say, well, I couldn't afford the copay, I was like, what are you talking about? Right? I ordered it. You have to do it. Right. Yeah. So, that piece has kind of changed too. But I think the biggest thing, honestly, that's drawn me to the wellness side is kind of that optimization of the patient, kind of helping them, as they are trying to figure these pieces out. How do I keep my bone health, good? How do I get the weight off? All of these things. And, even some of the other wellness things that are less well known. Red light therapy is an example that I use all the time. As a physicist, I was fascinated by red light. I was totally going into it expecting it to be bogus and not a real modality. And as I got into the research behind it, I realized there's like more research around red light therapy than there is around a lot of the things that we give every day. So it really is pretty interesting and funny how these things have morphed. But to me, the wellness and orthopedic mix is natural, right? People are trying to thrive. They're trying to live healthier lives. I'm in a position with my knowledge and expertise to try to help them in that direction. And if I just take a shoulder, Brad comes to see me for his shoulder, and I'm like, well, Brad, you got a rotator cuff tear. Well, that's only part of the story. How did it tear? What happened? What led up to it? Number one, how do we optimize you for surgery as we go in to do it? And then ultimately, how do we help you recover better? Right. And a lot of these things are kind of in the wellness side. So I kind of see it as an intersection between the two. And I kind of see that where the future is going.
I'm interested too. That's so fascinating. And it makes so much sense. For the audience sake, an orthopedic practice is typically, has a heavy insurance bent to it. Do you have kind of a mix of kind of cash pay elements to your practice and insurance, or talk a little bit about, those things that you face as you're integrating some of these, kind of wellness concepts into your practice?
Yeah, that's a really hard question. And that's actually, on the list of challenges I have, right? How do we separate out the cash side from the insurance side? And the short answer is I have both, right? So I have services that insurance in no way, shape, or form is ever going to cover that I believe in. And I have cash prices for those. And then, of course, I have the regular challenges of cash pay in the orthopedic practice. How do you separate the two? And I think it's a fundamental question. And I'm very transparent and open about how I approach this with the patients. And like I said, 15, 20 years ago, I never talked about cash, and now it's part of every conversation. And, kind of the cost to benefit ratio of different treatments that I'm doing and what can they do. And I do try to keep them separate, but I do have modalities that kind of cross over into the two. And I have it set up as separate businesses for myself. I'm sure there's lots of other ways to do it.
Yeah, it's super complicated, and we could probably talk for a long time. It's a big problem that we're helping clients solve across, multi-specialties. But it's really fascinating because you're coming at it from a place of, a gap that you see for the patients that will help them and why they believe they're showing up. Kind of the Brad shoulder example.
By the way, all that's correct. I do have a teared rotator cuff and I do need surgery.
Sorry, I don't think I broke any HIPAA there because I don't know if we've ever talked about that.
No, we haven't.
We've talked about it on the podcast because there have been phases I've had to lift his bag into the overhead on the airplane, and I've made sure to tell the audience about it.
It's gotten better.
You're a good friend.
There's strings attached to the help I provide.
Yes, that's right. Your name is listed first.
Oh, well, another interesting thing about biologics is that it's a hot topic, and it's kind of on the the cutting edge of medicine, and so what we're seeing is that there's there's a lot of bad actors out there. There's a lot of differing phases on not just the research, but where does it stand on the FDA from an FDA approval process. So what recommendations do you have on how to talk about the health benefits that can come from these treatments?
Yeah, that's so hard. First off, I have a interesting practice in that I have kids all the way up to 90, 100. One was probably the oldest patient I've seen in the last month that I know of. So you kind of have this range of people, and first of all, it's very interesting to me where they get their information. Okay. So a lot of these guys, this is a true story. I had and it seems like I'm making this up, but I'm not. And maybe you guys hear this all the time, but I had a 19-year-old college student. I did a stabilization procedure for his shoulder. So basically he was dislocating his shoulder. I fixed it so it didn't dislocate anymore. Well, he always came in with his parents to the appointments. Well, this one appointment, he comes in without his mom and dad, and he's sort of talking to me, and he's like, towards at the end of the appointment, he's like, "Hey, doc, I've been using BPC." I'm like, what, really? And he's like, yeah, yeah. And I hear this kind of all the time, right? I kind of get this stuff, but this one was interesting to me because I'm like, well, where are you getting it? He goes, well, I ordered it from the equivalent of like an Amazon, right? I just ordered it. And I'm like, and then you injected yourself with it? I'm like, wait, seriously? And I'm like, and so, I mean, look, the hard part is, I'll probably be using it someday, right? Mm-hmm. And right now I'm not, because it's on the do not compound list. It's just got through, as you probably know way more about this than I do, got through the category 2 status. If I'm saying that wrong, I apologize, but it's not able to be compounded yet. So if you're getting it online, you're either using it for research purposes or you are using something that is from an unregulated pharmacy, which, is just crazy to me. Yes. And I'm just kind of like, I'm trying to explain this to these guys. And look, I'm not trying to poo-poo it, right? It's like, it's probably great, right? But there's just not, there's not a lot of research and studies around it. So look, my first rule when I'm trying to evaluate these things is humility, right? So if you're coming at it and the more exciting the claim, I think the more disciplined we have to be before we just start spitting it out there. And these kids are getting all their information from the influencers, from TikTok and Instagram. And I get these things forwarded to me all the time. I went on spring break with my son and 4 of his friends. And the first night we're sitting around the table, and they're all just pelting me with peptide questions. And I'm like, how do you even know what peptides are? And they're going at it, and they're asking me. They knew more about it than I did, honestly. And I'm like, okay, well, I guess I better learn about these. So anyways, I think it's pretty interesting. To me, the right approach is to be maybe a little bit, not really cynical, but also not reckless, if that makes sense. Yeah. I think that you got to have kind of a disciplined curiosity. And so I don't ever, red light was a great example I said earlier. If you had asked me before, I would be like, it doesn't work, Yeah. But I think you go into it, you kind of, you look at the research and you try to study up on it a little bit. Whatever you do, you have good conversations with the patients. You explain the pros and the cons. You talk to them about, what the evidence support the outcomes might be. But you've just got to be honest with them and tell them you don't really know, because guess what? There's not a lot of great studies out there on this. And why aren't there studies, right? I could go, this again could be a whole other podcast, right? But, in orthopedics in particular, about 67%, somewhere in that range of our studies are level 4 studies, which means, hey, I did this to 20 of my patients and these were my results, right? It's not kind of real evidential. But you think about what would it take to do a prospective double-blind study on a peptide therapy, right? Well, you'd have to have 100 people agree to get the procedure and 100 people agree to get a placebo injection, right? No one's going to do that. I want to do it. But then plus from the wellness side, I'd have to be doing that for free. So I'm paying for the compound. It's not like I have a sponsor for it. Yeah. So it's really hard to kind of get there with this. So I approach it kind of with a framework and first, what's the claim that's being made, right? Is that real? It can't be generic. It can't be, this is for optimization or regeneration. We really need to say, hey, specifically, what is the outcome that's being implied, right? Second, is there evidence? Is there any evidence around it? What is the quality of the evidence? And that kind of speaks to what I was talking about a minute ago. You might have a small case series. Are there big, meta-analyses of these, and then the third is it standardized? PRP is a great example of this, right? So PRP, it is technically a biologic. It's not a peptide. And I don't mean to kind of conflate the two, but, PRP is, for years, we kind of didn't know, does it work? Does it not work? And it turns out there's not a lot of standardization of how many platelets you're getting. And it's a big difference between, a 10x platelet and the 4x platelet dose. And so, that's pretty interesting as well. And then we kind of alluded to this, the risks, what are the risks of this procedure? Is it worth the risk? Do we have enough evidence in one of the first, in that second bucket? And then finally, probably as important as who's benefiting from it financially. And I'm not even saying that financial benefit's wrong. It's just, it should be transparent. And so I think it's interesting. It's an interesting space, and I think everybody has to develop their own framework that works for them. But I think, that's one of the roles that we can do as physicians. We've had the training, we've learned about it. And I think we can learn to have these conversations with our patients about what works and what doesn't work. Here's what we think. And then, of course, I know you guys as attorneys know how important informed consent is, right? Let's make sure that we have all the information out there and have it documented properly and explained properly. And that's a whole other conversation.
Well, that's awesome. And we got time for one question left. So this will be like a speed round question, but kind of want you to look out into the future. I mean, you've been coming at this over the last, almost decade. It sounds like, just looking at being a doctorpreneur, a lot of different things that are changing in medicine, coming at it from the orthopedic side, but then looking at other ways to help improve your patients' outcomes. Now I'd like you to think, well, the next 5 to 10 years, how will this wellness space impact just in general? If you think looking at orthopedics in general, like what will change for the typical orthopedic practice when they start thinking about wellness?
Yeah, I think it's really, it's applicable across all specialties, right? For the future of longevity and wellness. I think that, like I mentioned at the beginning, it's not going to be, I think people are going to be looking for less fragmentation, right? I think they're going to be less transactional. You want an integrated plan, right? The weight loss. How do I lose weight without losing muscle mass, right? How do I build up my bone health? Where do I get my information from? How do I sleep better? How do I, all of these things have influence in the orthopedic space too. It's kind of the same all the way across. I think that direct care models are going to be the future. I think that's a model that's growing all the time. And, direct primary care, there's even direct orthopedic care out there. I think that is, one potential way of removing some of the friction that we see in the current healthcare system. And it also allows the integration of these pieces. So I really think that's going to be a big piece of it moving forward in the future. I think wearables data has big time orthopedic implications, but also general wellness. I have my own wearable. I kind of track my sleep, and, they say you can't change what you can't measure. And I am a testament to that, because I have gone from probably averaging 4 to 5 hours of sleep a night up to 7, which is huge for me. So it really does work. I think recovery is going to become a legitimate piece of healthcare. I think, the way I hope things go is I hope that we kind of shift that wellness continuum from sick care, kind of on the left side of the continuum, to kind of preventative longevity wellness. And that's where I hope things that are, are going to head. And I hope that some of the regulations are kind of fixed up a little bit more clearly. I know you guys are a big help to those pieces. So that's my hope for where it goes, but not just across orthopedics, but across medicine in general. I think that basically, like I said earlier, improving access and cost for the patients, and for the physician side, kind of improving that doctor-patient relationship, taking care of some of that administrative burden, maybe limiting some of the burnout. These are all things that I hope that we can kind of get towards, and that's where I think things are heading. Because I think people have honestly gotten to a point where they're very frustrated with the way things are currently, and I think there's a lot of opportunity. I'm excited about it. I think there's a lot of cool things coming out there.
Fascinating. Well, we've, believe it or not, sped through our time. Thank you so much for joining us on the Legal 1-2-3s with ByrdAdatto. We're grateful for you, and we'll go to break and come back with a quick wrap up. Appreciate you.
Sounds great. Thanks, guys.
Many business owners use legal counsel as a last resort rather than as a proactive tool that can further their success. Why? For most, it's the fear of unknown legal costs. ByrdAdatto's Access Plus program makes it possible for you to get the ongoing legal assistance you need for one predictable monthly fee. That gives you unlimited phone and email access to the legal team, so you can receive feedback on legal concerns as they arise. Access Plus, a smarter, simpler way to access legal services. Find out more. Visit ByrdAdatto.com today.
Welcome back to Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, with my co-host, Michael Byrd. Now, Michael, for those who don't know, this season, our theme has been the future of wellness, and we had just an amazing conversation with Matti Palo, and he, coming from an orthopedic world and hearing everything, we liked it so much that we let him go a little bit longer than general because we wanted to keep going. But unfortunately, audience members, believe it or not, we are actually out of time today. But don't worry, we'll be back next Wednesday with a fan favorite. Can a medical practice offer stem cells or exosomes? With Dr. Jordan Plews. Thanks again for joining us today. And remember, if you like this episode, please subscribe. Make sure to give us a 5-star rating and share with your friends.
You can also sign up for the ByrdAdatto newsletter by going to our website at ByrdAdatto.com.
ByrdAdatto is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Reference to any specific product or entity does not constitute an endorsement or recommendation by ByrdAdatto. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Please consult with an attorney on your legal issues.